Remember to subscribe Happy Parenting and click the bell icon for more videos.
Here's everything you need to know about COVID-19 in kids. A lot of children have been getting sick with the COVID-19 or coronavirus. Kids are usually pretty strong and they usually recover easily. But if they are very young or if they have some other health issues, they can be really sick. What is COVID-19? COVID-19, known officially as coronavirus, is a global pandemic that began in December 2019 in Wuhan, China, and has since infected nearly 10 million people worldwide and caused more than 500,000 deaths. Can newborn baby affected by COVID-19? Babies under age 1 might be at higher risk of severe illness with COVID-19 than older children. Newborns can get COVID-19 during childbirth or by exposure to sick caregivers after delivery. COVID symptoms in babies, toddlers, and children. Generally, COVID-19 symptoms in kids and babies are milder than those in adults, and some infected children may not have any signs of being sick at all. COVID-19 symptoms for children and adults include cough, fever or chills, shortness of breath or difficulty breathing, muscle or body aches, sore throat, new loss of taste or smell, diarrhea, headache, new fatigue, nausea or vomiting, congestion or runny nose. Treatment of coronavirus for kids. If you think your child might have COVID-19, talk to your child's healthcare provider. Keep your child at home and away from others, except to get medical care. If possible, have your child use a separate bedroom and bathroom. Follow recommendations from the Centers for Disease Control and Prevention and your government regarding quarantine and isolation measures. As needed, focus on symptom relief. This might include rest, plenty of fluids, and use of pain relievers. Call the doctor if your child keeps getting sicker. What can I do to prevent my child from getting COVID-19? There are many steps you can take to prevent your child from getting the COVID-19 virus and spreading it to others. The CDC recommends getting vaccinated. COVID-19 vaccines reduce the risk of getting and spreading COVID-19. A COVID-19 vaccine can be given to eligible children on the same day as other vaccines. Wearing face masks. If you are in an area with a high number of people with COVID-19 in the hospital or new COVID-19 cases, doctors recommend wearing a well-fitted mask indoors in public. Whether or not you're vaccinated, don't place a face mask on a child younger than age 2 or a child with a disability who can't safely wear a mask. Keeping hands clean. Encourage frequent hand washing with soap and water for at least 20 seconds, or using an alcohol-based hand sanitizer that contains at least 60% alcohol. Have your child cover his or her mouth and nose with an elbow or a tissue when coughing or sneezing. Remind your child to avoid touching his or her eyes, nose, and mouth. Cleaning and disinfecting your home. Clean high-touch surfaces and objects regularly and after you have visitors in your home. Also, regularly clean areas that easily get dirty, such as a baby's changing table, and surfaces and items that your child often touches. Choosing safer activities. Choose outdoor activities when possible or indoor activities in well-ventilated spaces. Avoid activities that make it hard to stay 6 feet or 2 meters away from others. Limit visits with people who are unvaccinated or whose vaccination status is unknown. Keep distance between your child and others when in public. Avoid close contact with people who are sick, if possible.